Preparing patients for breathing exercises. Consider administering analgesia prior to starting. If the patient has pain, they will not be able to perform the exercises. Mobilize the patient to ensure they do not acquire a lung infection or atelectasis. Sit the patient out of the bed or up in the bed. The aim is to optimize lung expansion. Critical care patients can sit out of the bed if they are hemodynamically stable. This allows for better lung expansion. Ensure you have 2 to 3 clinicians assisting with any IV lines, cardiac monitoring, drain tubes, and etc. Ensure the patient is comfortable. Place a folded towel up against the patient's chest or abdomen to provide comfort and security around any wounds they may have. Deep breathing and coughing. Pursed lip breathing. Pursed lip breathing is a technique that helps to control breathing rate and improve your shortness of breath. Helps the client develop control over breathing. The pursed lips create resistance to the air flowing out of the lungs, thereby prolonging exhalation and preventing airway collapse by maintaining positive airway pressure. Breathe in slowly through your nose. Inhales to a count of 3. Pause. Purse the lips as if about to whistle. Breathe out slowly and gently, tightening the abdominal muscle to exhale more effectively. Exhales to a count of 7.
Diaphragmatic breathing. Diaphragm is made up of 2 large dome-shaped muscles located just below the lungs. If they are tightened, there is more room in the chest cavity for your lungs to expand. The diaphragm also pulls the lungs downward and helps draw air into the lungs. Diaphragmatic breathing permits full breaths with little effort. In a comfort position, place one hand on your abdomen above your belly button. Breathe in slowly through your nose. Feel your belly rise slowly as you breathe in. Let the air out through pursed lips. The upper part of your chest should stay relaxed. Once you are able to do this type of breathing, both sitting and lying, try using it while standing and walking. Exhale through pursed lips. Coughing. Coughing is important because it helps remove sputum from lungs. When sputum is removed, breathing is easier. It is helpful to cough early in the day to remove the sputum that has built up during the night. It is also helpful to cough well about a half an hour before lunch and supper. It may help make meal more enjoyable. Before going out, cough to clear any sputum. Coughing gently or making short grunting noises with mouth slightly open will help loosen the mucus. Controlled coughing technique. Controlled coughing is one of the essential techniques in both respiratory care. Patients perform this maneuver after each drainage position and often throughout the day. The abdominal muscles are very powerful muscles used in coughing and exhaling. Sit comfortably with your feet resting firmly on the floor and lean forward slightly. Take 3 to 4 deep diaphragmatic breaths before coughing. Take a deep breath, hold your breath for 3 seconds, tighten your abdominal muscles, and cough twice. The first cough will loosen your sputum. The second cough will move the sputum high into your throat. Spit it into a piece of tissue and check the color. If it is yellow, green, or red, talk to your doctor. Throw the tissue away. Take a break and repeat once or twice if you do not have any sputum.
Chest physiotherapy is a technique used to mobilize or lose secretions in the lungs and respiratory tract. This is especially helpful for the patients with large amount of secretions or ineffective cough. These treatments designed to eliminate secretions thus helps to decrease work of breathing. promote the expansion of the lungs, and prevent the lungs from the collapse. Postural drainage is an airway clearance technique that uses the effect of gravity to clear secretions from different segments of the lungs. As postural drainage is using the effect of gravity, the affected part of the lungs needs to be positioned at a higher point of the body in order for the secretion to move. Patients should stay in each position for 10 to 15 minutes for most effective treatment. Postural drainage is combined with techniques like chest wall vibrations and forced expiration techniques to achieve better efficiency. Do not perform it with a full stomach. The patient should do it before a meal or at least 1.5 hours after a meal. Do not perform it if the patient has or develops any of the following symptoms: gastroesophageal reflux or acid reflux, nausea, significant increase in breathlessness, fresh blood in your secretions, recent rib, spine or muscle injury, wheeze that is caused by bronchospasm. Position 1 is for the secretion at the front and top of both of the lungs. Sit up in bed. Position 2 is for secretion at the back and top of both lungs. Sit up in bed, lean forward onto 2 pillows. Position 3 is for secretion at the front upper portion of both lungs. Lie facing up with the pillow under your knees for comfort. Position 4 is for secretion at the upper back portion of right lung. Lie on left side with knees bent. Place 1 pillow under the chest and rotate body slightly forward. Position 5 is for the secretion at the upper back portion of the lung. Lie on the right side with knees bent. Place 1 pillow under the chest. Rotate body slightly forward. Elevate head of bed. Position 6 is for the secretion at the middle right lung. Lie on the left side with knees bent. Place 1 pillow behind the back and rotate body slightly forwards. Elevate the foot of the bed 15 degrees. Position number 7 is for the secretion at the middle left lung. Lie on the right side with knees bent. Place 1 pillow behind the back. Rotate body slightly backwards. Elevate the foot of the bed 15 degrees. Position 8 is for the secretion at the front lower portion of both lungs. Lie facing up with the pillow under the knees for comfort. Elevate the foot of the bed 20 degrees. Position 9 is for the secretion at the back portion of both lungs. Lie facing down with 1 pillow under abdomen. Position 10 is for the secretion at the lower back portion of both lungs. Lie facing down. Elevate the foot of the bed 20 degrees. Position 11 is for the lower back portion of the right lung. Lie on the left side with knees bent. Place a pillow under chest. Rotate body slightly forward and elevate the foot of the bed 20 degrees. Position 12 is for the lower back portion of the left lung. Lie on the right side with knees bent. Place a pillow under the chest. Rotate body slightly forward. Chest wall vibrations. Chest wall vibrations involve the application of fine oscillatory movements combined with chest wall compressions, initiated at the end of the inspiration and applied through expiration. The chest wall vibrations move secretions towards the larger airways for removal. You may put a layer of towel over the chest wall area for comfort. Technique number 1. With one hand over the other, place hand firmly on the chest wall. over the part of the lung that needs to be drained. Press the top and the bottom hands into each other. Instruct the patient to breathe in and breathe out. As patient breathes out, tense the muscle of your arms and shoulders and apply a light vibrating pressure in an inward and downward direction. Instruct the patient to cough or huff forcefully if the patient feels that the secretion are in his throat. Technique number 2. Place your hands side by side firmly on the chest wall over the part of the lungs that needs to be drained.
Percussion. Percussion, also referred to as cupping, clapping, and tapotement. The purpose of percussion is to intermittently apply kinetic energy to the chest wall and lungs. This is accomplished by rhythmically striking the thorax with a cupped hand or mechanical device directly over the lung segments being drained.
Cupping or percussion.